This is Blaire with Cora Medical, home of AED.us, and today we're going to talk about how to use an AED on a pregnant woman. At the end of every CPR class I teach, we play a game of true or false. One of the most common questions each time is, can you use an AED on a pregnant woman? While there appears to be some uncertainty, the answer is absolutely true. You should treat a pregnant woman as you would any other victim of sudden cardiac arrest. According to the American Heart Association, responders treating a mother suffering from cardiac arrest should not be concerned about harming the fetus by doing CPR or using an AED. It is perfectly safe to do so. In fact, choosing not to administer these life-saving techniques will greatly decrease the chances for survival, not only for the mother, but for her unborn child as well. So let's start covering how to use an AED on a pregnant woman. The answer is simple. Use the same technique you would if the victim were not pregnant. However, there are a few different precautions and best practices recommended by the American Heart Association. When you call 911, inform the operator that the patient is pregnant. This allows EMS responders to take special precautions. When you begin CPR, make sure to perform chest compressions the same as you would for a woman who is not pregnant. Your compressions should be hard, fast, and targeted at the center of the chest at a rate of 100 to 120 compressions per minute. If the pregnant patient is revived, she should be placed on her left side to improve blood flow to the heart and fetus. So can you use an AED on a pregnant woman? Absolutely. Do not hesitate to administer the same life-saving skills you would on someone who is not pregnant. More than one life could depend on it. If you have any questions or for purchasing options, please give us a call at 800-695-1209 or visit our website at AED.us. Thanks for watching.